Good evening, everyone. Welcome to Inspira Advantage's webinar on deciding between a DO and an MD. We're so glad that you all could be here. We have some great panelists to walk you through the differences between a DO and MD and how to decide what choice is best for you. Before we dive in today, we'll quickly go over the agenda. So we'll introduce our panelists, and then we'll talk about the differences between a DO and an MD. We'll talk about the applications, education, and tuition differences, how the career and lifestyle differ, and how to decide which path is best for you. And at the end, we'll take some time to answer some Q&A questions. So feel free to pop your questions into the Q&A box, and we'll get to those at the end. Our two panelists today are two fantastic Inspira Advantage consultants. They have done an amazing job helping students apply to medical school. We have Nakia and Andrew, and they're going to walk us through the differences between a DO and an MD and answer your questions at the end. All right, Nakia, do you want to walk us through what a DO is?
Yes, so a DO is a doctor of osteopathic medicine. It actually started, I believe, in the 1800s when the traditional medicine at the time was focused a little bit more on potentially medications that were not regulated and could cause harm to patients. So the philosophy was to get a better understanding of the body and the body's like intrinsic mechanics and be able to use that to help diagnose, to diagnose and treat a patient at the same time. And that's what osteopathic manipulative treatment essentially is. It's called OMT. And it's using the body's mechanics in order to see what is wrong with the patient. Obviously, in the 1950s and 60s, medications became more regulated with the FDA. And so the osteopathic doctors also adopted that as well. And so we do prescribe medication. We do heavily, I'm in surgery, so we do heavily rely on medications to be able to treat our patients. But it's essentially just the philosophy of the osteopathic manipulative treatment as an extra form of being able to help diagnose somebody and looking at someone in the whole picture, instead of just maybe, on top of the quantitative stuff. It's just an extra added asset.
Fantastic. Thanks so much. So this is a little graphic that just goes into what some of the similarities and differences are. And as both Andrew and Nakia mentioned, DOs have a little bit more of a holistic approach, where MDs are a little bit more symptom resolution oriented, but both prescribe medications, order testing, work in multiple different specialties, and are fully licensed. So this here, we'll talk a little bit about the applications for both DO and MD programs. Nakia, do you want to start here?
Yes, so they're pretty much the same, but there are two separate application systems. There's AMCAS for MDs and ACOMAS for DOs, but they all share these similar traits of they're going to have separate application fees for primaries and secondaries. They're going to require letters of recommendation. They're going to require a curriculum vitae with all of your activities and extracurriculars and any research that you've done to be displayed on that. And they're also going to require a personal statement that really reveals who you are and why you want to go into medicine. Just one added thing is that for letters of recommendation for DOs, it would be beneficial to have a DO be one of your letter writers, so that they know that you have an understanding of what it is to be a DO and have a familiarity with that.
Andrew, do you have anything else to add here?
No, I think that's perfect. I agree that the DO applications usually need a DO letter writer. And as Nakia said, it's a lot about research. It's a lot about your volunteering and any clinical experiences you had to really bolster that application. But otherwise, it's similar costs, similar sort of personal statement narrative, similar secondaries come through afterwards, and the interview styles are usually relatively similar.
Perfect. All right. Andrew, do you want to talk a little bit about the stat differences between DO and MD programs?
Sure. I mean, there are statistical differences between like MCAT score, GPA, but it's skewed because there are much fewer DO programs than MD programs. And as the earlier slides have alluded to, this does not preclude you from practicing medicine if you are one or the other, right? It'll be effectively the same, and even the nuances in education ranging from like holistic to medicine with diagnostic, like, in DO school, you do learn differential diagnoses, and I'm sure Nakia can attest to that. There's no way you get around that aspect of it. And similarly, like we actually do have some classes on more holistic body medicine. Like we took a physical therapy class or had a physical therapist come teach a couple lectures to help us know like different joint maneuvers and stuff like that. And just in terms of the statistics, this is really for applicants to realistically try to see where you would best fit in and statistically try to get interviews at these programs. But again, there's ranges for MD schools and there are ranges for DO schools, and these are just means.
Great. Nakia, do you have anything else to add here?
No, I think the important thing to know is that it is difficult to get into a DO or an MD school. At the end of the day, the acceptance rates are low for both. There are just tend to be more applicants for MD programs because I think traditionally MD programs have been more well known. But I think especially now that the residencies are combined, the allopathic and osteopathic residencies are all combined under the ACGME, which is the governing body essentially for graduate medical education across the United States, that it's becoming a lot more popular and a lot more well known than when I was applying almost 10 years ago.
All right. Nakia, do you want to take us through some of the similarities between the two?
Yeah, so I think as we kind of explained before, but you're going to have to take your MCAT. You're going to have those prerequisites with all the courses in biology, chemistry, organic chemistry, physics, all that stuff. You're going to have to complete a 4-year medical program. Some programs are 5-year, even in DO and MD programs, if they have research years that are incorporated into them. But you do have to, complete it in order to become a doctor. You have the ability to go to a 3 to 7 year residency and fellowship afterwards. You have the ability to specialize. I think we're going to go over this a little bit in the future, in the next slides, but with the specialties, with MDs, you have a wider range of specialties to choose from. And for DOs, you have that same ability, but you have less of a chance because it's not as common for DOs traditionally to apply for dermatology, plastic surgery, interventional radiology, orthopedic surgery, even general surgery. But things have, like I said, been changing in the more recent years, so that is no longer seen as a limitation where if you get a DO degree, you are limited to only family or internal medicine. You do have to take board exams to be licensed. If you're a DO, you take COMLEX. If you're MD, you take the USMLE. As a DO, you can also take the USMLE as well. And then you can practice in all 50 states. The tuition is pretty similar. I think there's a wider range in MD schools because they have some state tuition, so it could be actually cheaper in some institutions, but they're pretty much the same. And like I said, DOs and MDs can both have surgical privileges as well. And we do all prescribed medications in all 50 states.
Fantastic. Andrew, any additional thoughts here before we move on?
No, I think that's perfect. It goes into the next slide perfectly.
Yeah.
All right. Andrew, you want to talk about some differences, particularly with MD
Sure.
programs?
Absolutely. I think these differences, as Nakia was mentioning, are actually pretty rapidly, becoming non-existent, right? MD and DO programs the degrees are equivocal. The residency programs, now that they've been combined for a couple of years now, are applicants are treated almost equally. I mean, I think there are a couple of exceptions, but otherwise, the same. There's a lot of, at least for anesthesia, there's a lot of DOs, a lot of MDs, pretty equally throughout many prestigious programs. USMLE and licensing, I did not take complex, so I can't say what it's about, but the USMLE is terrible no matter how you slice it. And if you take it, that's great. And if you take it plus the other complex exam, I mean, it's probably studying for similar things. In terms of specialization, it's weird because it's always just like a personal preference more than anything. So I actually have to run very quickly to sign up, and I'll be right back.
All right, Nakia, you want to take over?
Yes, no worries. Exactly what Andrew said, that you can, there's a lot of DOs traditionally that weren't in, surgery or anesthesia, like more of those procedural specialties, and more it's becoming more common and well known. The big difference is with the licensing exam that you take. So you take, it's like step 1, step 3, and step 1, step 2, step 3 for USMLE, and level 1, level 2, level 3 for COMLEX. And there's also a physical, like a physical assessment that you do with the clinical scenarios in both of those exams. And with a DO, in order to be considered in some of the more traditional allopathic residencies, they recommended that you take COMLEX and USMLE. So that was something that you had to consider, that you had to take 2 exams at the same time, and versus MDs only had to take the 1. I don't think that is that much of an issue now that it's becoming more common, but you can take and sit for the USMLE if you are a DO candidate in medical school, but you cannot sit for the COMLEX if you're an MD, MD candidate. And but both are recognized by residencies, and they are able to assess how you do. So it's your choice. And like I said, some DOs did tend to go into primary care because traditionally that's where the focus was. But again, it's been changed. There's at least 3 DOs that were in my class, in particular in general surgery. And I have many colleagues who are orthopedic surgeons, who are anesthesiologists, who are interventional radiologists, and plastic surgeons, who are all DOs. So again, I don't think this is as common anymore. And I think this next slide, we already went through a lot of these, but this is kind of just an overview, another way to look at it in terms of the differences of MD and DO.
All right, we'll leave this up for just a second. And I do want to point out, Nakia mentioned earlier that tuitions are pretty much equal now, depending on in-state or out-of-state. And they vary across the board.
So a lot of DO schools are private. So that's one of the reasons why it is more expensive versus some medical schools are public, and so that they have lower tuition rates. But again, like I think the most expensive medical school is an MD. So it just depends on where you are. So in terms of the match rates, so MDs have higher match rates overall than DOs, but it's different to like 92% versus 89%. It's a 2 to 3% difference. It could be this difference is a credit to some DOs who maybe apply to highly specialized like residencies, and that, again, like traditionally they weren't accepted, but now things have changed. But overall, it's pretty much the same. And MD students can now that they combine the match, there's a wider pool of students who are, or a wider pool of candidates who are able to go into residency, which is nice. I would compare this to an IMG. So the reason that they combine is because it gives preference to those students who did their schooling in the United States, and that's MD and DO. If you're an IMG and you came in with similar credentials in terms of your USMLE exam, and that was with the DO student would get the preference, or the MD student would get the preference because they're in state. And that's one of the reasons why they combined the program, so that all school, DOs no longer have to choose which match they have to go into, an allopathic or osteopathic match. It's all just one match now. And so our spots get filled by US students in priority. And then obviously IMGs get put into that category as well. So career and lifestyle is pretty much the same. It just depends on the specialty that you choose. So if you are an MD or a DO and you want to have more of a a lifestyle where you're not on call in the middle of the night, or you don't have to work as many weekends, then you could maybe, dermatology may be one of the things that you may want to go into, or even family medicine. But family medicine also has long hours now with all the patients that you're seeing. So again, the lifestyle is very dependent on what kind of specialty you want to get into. So it doesn't determine, like, your education doesn't determine the kind of lifestyle you're going to have. You're both able to care for patients and be fantastic doctors, and your patients are going to look up and trust you, whether you're a DO or an MD. They're just going to see doctor in front of your name, and they know that they're going to be in good hands. Again, salary is the same based off of your specialty. So you're not going to get paid more or less if you're an MD versus DO with the same credentials for salary for a certain specialty. One difference is that traditionally MDs can practice anywhere internationally and was recognized. DOs, I think, they can practice in the US in about 50 countries. This hasn't really been a problem. I've known of DO surgeons who've gone on medical trips internationally and been able to practice and do surgeries on underprivileged populations overseas without issue. So again, I think that's just all changing because of recognition. But if that is something to consider, that if you do want to have the mobility of going to any international country, that you would have to check the rules and regulations. But most countries do have it. And Canada also has an osteopathic association as well, and some medical schools. So that's new. And again, this is just kind of talking about what we talked about with international students. But again, MDs are more flexible, but not as changing. So deciding which path is best for you. So the main consideration is how you want to practice medicine and how you want to view the human body. I think both MD and DO do a lot of deductive reasoning and look at symptoms to be able to get to an answer. But with the DO, you have an extra toolbox, an extra tool in your toolbox to be able to use osteopathic manipulative medicine that you may not get in MD unless you get offered an extra course, or you take an extra course on that, on physiology. So that's the main thing, is just how your philosophy is. If you're interested more in research, you can be a DO or an MD. If you're interested in going to academic program, you can be a DO or MD. But again, it's just about your philosophy and the culture of the program. So it's really important to review that when you look through medical schools and see what kind of philosophy you identify yourself with. In terms of the MCAT score, GPA, and the resume, they all have to be pretty similar, but traditionally MCAT scores are lower for DOs, but it's not, people tend to get into both MD and DO schools and have to kind of choose between both. So it's very comparable. And if you are planning on specializing, which program would be conducive to that specialization? So if you're very, adamant about getting into a particular specialty, and you may know where an area you would practice, a good thing is to look at the residents who are currently there at that residency and see whether or not they were DO, MD, or what DO program, what MD program, and to kind of get an idea of where they where they kind of look for their candidates to come to their program. And so that's something to consider when you're looking at, if you do know what you want to do, if you're considering between the two schools. And again, the residency match rates for various specialties. So again, if you want to go into dermatology, maybe DO is not the best one because it is a highly, highly competitive residency, but it's not impossible. It is just an uphill battle, I would say, for that. And then consider where you want to practice. Because there are not as many programs. They tend to be sometimes in more suburban areas, but there are ones in urban places like Touro and Harlem. They have a couple campuses. They have one in Manhattan, and then they have one an hour outside of New York City. So there's a wide breadth, but that's going to take into consideration of the kind of patient population that you work with, and also how your living situation is going to be.
All right, that brings us to the end of the information that we have for you all. Feel free to start popping some questions in the Q&A, and we'll have Nakia and Andrew, once he gets back, answer those for you. While we wait for some of those, Nakia, when we were talking earlier, you said that you applied to both MD and DO programs and ultimately decided with a DO. What kind of fueled that choice?
I just felt like I had more options in my clinical rotations, and that was like one of my major focuses, that I was able to do sub internships. Essentially, it's like a practice internship month from like the DO program versus the like some of the MD ones. So I really like that I was able to explore like different types of clinical rotations with the DO, and not just be at one institution and one hospital for the entirety of my 2 years of clinicals. 1 year was at my institution, and then the other year I had the option of going to other places. I think that was the main attractor for me. That's a personal thing, just because I'm from California originally, and I moved out here to New York 8 or 9 years ago when I came for medical school. And so at the time, I didn't want to be just in New York. I wanted to also potentially come back to California. I do love New York, and I'm actually don't want to go back to California now. So I did rank my residencies to be higher on the East Coast, but you just never know. So I just wanted that flexibility early on.
That makes a lot of sense.
Yeah.
Is there anything that you wish you had known when you were applying to med school and both programs, that about DO specifically or MD specifically, that we didn't cover today, or anything you want to expand on there?
Yeah, so I think one thing was that when I was applying to DOs, I had that preconception that like, oh, it'll be easier to get into, and I'll get more interviews and things like that. But actually, I didn't have initially like a letter of recommendation. I had like pretty high stats, but I didn't have a DO letter of recommendation. And although I did apply early, I felt like I was kind of scrambling for that experience. And so I just didn't like that I had to scramble before applying. So if you are determined to apply to both DO and MD schools, it's really important to have some sort of osteopathic background, some sort of experience, either shadowing, and have a letter of recommendation that's going to make you more competitive for the DO program, so that you'll have a higher chance of more interviews.
Great.
Also with MDs, I mean, I honestly, I have best friends who are both MD and DO, and they love their MD schools as well. So I think that just take into consideration when you're applying, like the culture of the program, and see if that would fit like with who you are.
That's a great tip. And we'll be having actually a webinar in about a week that covers building your med school list. And I think that's something we'll definitely cover as well. But
Yeah.
it's very important, especially when considering these two paths. So we have two fantastic panelists here. So feel free to pop in your questions, even if they're not completely related to DO or MD choices and differences. They're happy to answer your questions on anything and everything med school related and are experts in this application process. Anything else that you want to add to what we've talked about today, Nakia?
I think like at the end of the day, just have really good credentials so that you have the highest chance of matching into residency. I think we had a prior webinar where we're talking about the application process and the aspects of the application that one looks at and what's most weighted. And I cannot stress this enough that the MCAT is heavily weighted and heavily considered. I, as a consultant, can only do so much to optimize your already amazing, CV and make sure that your personal statement sounds like who how you want it to sound to really represent you. But at the end of the day, what's going to filter you for all programs, all medical school programs, is that MCAT score and your GPA. But MCAT score is a lot highly more considered than your GPA, because it's kind of like a standard way for them to evaluate you. If they don't know about your home institution or not very familiar with how your academic institution was when you're an undergraduate. So take the time to really study for the MCAT and get a score that you're proud of before applying to medical school.
It's a great tip.
Yeah. That's something I wish I knew. I took the MCAT twice, I only applied once because I knew that I didn't want to apply twice. It's easier to take the MCAT more times than to apply more times. I can financially as well. So
I'm sure a little bit less stress as well, a little less panic and exhaustion. Welcome back, Andrew.
Hey, so sorry to jump off there. I apologize. Late
No
night sign
worries.
outs. Absolutely
no worries. I'm gonna throw you the same question I asked Nakia a couple minutes ago. What made you decide to go with an MD program versus a DO program?
Yeah, I think for me, I applied. I applied straight out of undergrad, and I think I matched more with the MD schools, and I knew sort of I wanted to be in Manhattan for school. So it was both like geography and I think fit, and anecdotally, I just knew more people who went to MD schools. It wasn't really like evidence-based, which I think in retrospect maybe should have been a little more evidence-based. And but yeah, I don't really have a great answer, unfortunately. I'll try a different question.
What else did I ask you, Nakia? Is there anything that kind of surprised you about like DO versus MD stats and knowledge as you kind of went through your med school career?
I mean, I think anyone who has gone through this, and I'm sure Nakia, this, you are like what you make of your program and education. Like you can be the best DO or MD, and you can be the worst DO or MD, right? It's all about how much work you're putting in and how much you're really trying. I've seen rock stars on both sides, and I've seen not so much rock stars on both sides. So yeah, it's not really, the school doesn't make you who you are or dictate the caliber of clinician you'll be in the future. And also, I'll throw this in here too. Like if you're not set on medical school, you can always consider PA school, and there are other options as well that are very, very valid and have immense career satisfaction and, faster tracks because medicine is extremely long. And it feels like it's never ending. It's like Sisyphean at times. I feel like I'm pushing a stone up a mountain and it rolls back down, but
Mhm.
it's very rewarding. And, you can, um, I'm always so eager to learn more like holistic medicine from my friends who've gone through DO school. Like they're much better at the physical exam than I am, 100%. Like every time I will admit that, especially with like when I was doing outpatient stuff in medical school. We had some DO visiting students come in and they blew my exam out of the water because they're just so much more comfortable with manipulating joints and really understanding what normal feels like versus what abnormal feels like. We don't really get that as much.
Great. Thank you so much for that.
Yeah, Andrew, you put that very well, I would say. I agree with everything. I concur, doctor.
All right. Well, I think that wraps us up for today. I want to thank everyone for joining us. And Nakia, Andrew, thank you so much for being here. It was great to have you both. And stay tuned for future webinars. You can find them on our website. And if you are interested in Inspira Advantages services, feel free to schedule a free consultation on our site and you can talk to our team, kind of guide you through what programs might be best for you and how we can best help you get to where you want to be going. I hope everyone has a really great night. Thanks,
Thank you for
Andrew. Thanks,
having us
Yeah,
Nakia.
on.
thanks. Thank you.
Thank you for having us. Have a
Bye.
good night, everyone. Bye.
Thank you. Thank you. Bye.